how we support the delivery of user-centered design. So for me, Karen and I have worked, this is work where there's the expert by experience, have been heavily involved in co-designing, co-producing. Nick, you touched on, I think, in the first answer about accessibility and making sure. So, Nick, do you want to just share a couple more thoughts on that? And I'm mindful of the time, so I'm just going to ask for a couple of sentences from each of you on that.
Yeah, so UX design is not a core 1010 deliverable, but in terms of our experience of what good looks like for accessibility, absolutely that is, and we can assist with the designing in for accessibility. It's an unfortunate experience of mine over the years is that whether this be in healthcare or in private industry, that accessibility is sometimes a little bit of an afterthought. A system is designed and I was like, okay, well now how do we make this accessible, rather than how do we make it accessible from the ground up, because it needs a different set of behaviours from your development and delivery teams to make it as accessible as it could be. Can we help with that? 100% we can. Yeah, absolutely.
Great, thanks, Nick. Karen, thoughts from you?
Yeah, just quickly, I think the whole user-centered design approach is about an iterative design process which focuses on all of the users. Sometimes we forget some, as Nick has alluded to, but the example would be whilst we bring clinicians into service development, whilst we bring experts by experience on patients and carers, who do we miss out? Who do we miss out in the process? What do the admin infrastructure of an organisation have to say about the processes? And potentially there are opportunities and advice that they have to give as part of the process too. So it's about just researching all parts of the process journey and making sure that we have that we deliver something which makes the whole process as productive as possible.
Yeah.
So that's really just from my perspective.
Yeah, it's quite interesting that there's examples, for example, with robotic process automation, which is not user-centered design at all, but it is aligned to what Karen was just saying there about what do back office teams need, how can they be more efficient. There's an example, I believe, from East Lancashire NHS where RPA has saved something in the region of 83,000 paper referrals and things for appointments, and that saves 2.5 people's worth of admin time. There are benefits all over from thinking about it from different perspectives, rather than just from I'm a clinician or I'm a patient.
Yeah, that's a good point, isn't it? And I think just to add to that, my experience of doing sessions where I've done some emotional mapping. So rather than process, it's about how do people feel as they go through this, whether it's an outpatient appointment or whatever, it doesn't matter. But actually it gives you a completely different lens that you see things through, and then you can round out what's happening.
Yep.
Okay, good.
Phil, can I just add one more thing to that question, and that's around health literacy. So if we're asking patients to use the digital offer, we need to make sure that the way things are designed and the content are, they're able to interact with it and they understand it. And we've built into our project setup collaborative working with the Patient Information Forum, and that's helped us to ensure that patients, they've got the right structure, they've got the right content, it's been co-designed with them, and it takes account of health literacy best practice guidance. And I can really strongly recommend working with the Patient Information Forum, which is a charity, and they have, they helped us. Once I'd written our strategy, which we thought it was really quite well written, we asked them to look at it, and they completely rewrote it for us, because like they challenged us and said, if this is a patient-facing digital services strategy, it needs to be understood by the patients and citizens, and they did a fabulous job helping us with that. And through that process as a team, we learnt so much.
That's a really good recommendation, isn't it? And it's surprising, isn't it, that how easily we can plough forward without recognising that expert input we can get.